Thank you for watching YouTube Medical University. Today's topic is Loxonin and Kalonal. I'll explain the types of medicines, but first let me share a story. Recently, a pale-looking man in his 30s, Mr. A, rushed into my clinic. He had been experiencing sharp stomach pain, loss of appetite, and eventually even dark-colored. He reported passing dark stools and said, "I've been very busy at work recently and started having headaches but managed with painkillers." He said, "I was just enduring it. I was pressed by work deadlines, so even if I was hungry, whenever I had a headache, I just took that medicine," he told me weakly. As a result of the examination and tests, it turned out that Mr. A was diagnosed with a stomach ulcer. When we did a gastroscopy, there was active bleeding, and the reaction between stomach acid and blood caused the dark-colored stools. As you might guess, the cause was considered to be taking too many over-the-counter painkillers. The painkiller that Mr. A was taking is a medicine that you might have used at least once yourself. So, this time let's talk about a common painkiller. Loxonin and Kalonal, also known as Acetaminophen. I'll explain about them. Loxonin is sold at drugstores under names like Loxonin S, Loxoprofen or Kunihiro. And Acetaminophen, also known as Calonal, is sold over the counter as Tylenol A. Besides that, it's also found in common cold medicines. Many general cold remedies, the powdered medicine you take when you catch a cold, contain a lot of acetaminophen. These medicines are used when you have a fever, pain somewhere, menstrual pain, or migraines. These are very reliable medicines in such situations, but if you use them incorrectly, like Mr. A, you could suffer from side effects, and in the worst case, it could even be life-threatening. Which of these two medicines is right for you? What kind of side effects do they have? What's the difference between over-the-counter medicine and the medicine prescribed at hospitals? I'll clearly explain these questions from the perspective of a doctor who actually prescribes them to patients. So here is today's agenda. In section 1, I'll explain the differences between Loxonin and Kalonal and where they work in the body. Section 2 covers the top 5 side effects to watch out for and the riskiest drinks to avoid when taking these medicines. I'll also discuss common dangerous ways people take these drugs without realizing the risks. In the third section, so which one would a doctor actually choose? I'll provide a guide on how to choose the right medicine for you. From a doctor's perspective, I'll explain how to use them differently for headaches, fever, and menstrual pain. And in the fourth section, I'll cover questions that patients often ask. Is it okay to use both types of painkillers? Is it safe to take them for a long time? What should you do if they don't work? I'll be answering these common questions. At YouTube Medical University, we share essential medical info from a doctor's perspective in an easy-to-understand format to help you become healthier. Please subscribe so you don't miss any new videos. So in our first session, I'll clearly explain what Loxonin and Kalonal actually are. Let's begin with the medicine Loxonin, which is Loxoprofen sodium hydrate. It's a complicated name. If I had to describe one feature of this medicine, it's that it works quickly and is very useful for suppressing inflammation itself. If you've studied a bit of medicine, you might have heard of it. It's called a non-steroidal anti-inflammatory drug. When you hear about anti-inflammatory medicine, healthcare professionals might think of steroids. However, NSAIDs are a type of non-steroid anti-inflammatory drugs, and Loxonin is a representative example of NSAIDs. How does it work? It acts directly on the inflammation itself. For example, if you injure your shoulder, blood vessels in that area expand to bring in various components to help heal it, which can cause swelling and heat. This is called inflammation, and Loxonin suppresses the very substances that cause this inflammation. That's why it helps reduce pain and swelling. It's a really amazing medicine, isn't it? So, the characteristic of Loxonin is that it tackles the inflammation at its source, which means it works for pain as well as the inflammation itself. When these substances circulate in the body, they cause fever, but Loxonin can help lower it. As the swelling reduces, the pain subsides. It's an antipyretic analgesic because it reduces fever and relieves pain. Understanding the reasons makes it clearer. So, it's very effective and suppresses the inflammation itself, making it useful for things like injuries or toothaches. That kind of throbbing pain? Yes, that kind of pain. Loxonin works well for these kinds of issues. On the other hand, how does acetaminophen work? To put it simply, I have the impression that it's a mild and safe medicine. Over-the-counter medicines like Tylenol, Bufferin, and others, acetaminophen is included in cold medicines. So how do you think it suppresses pain and fever? Actually, the detailed mechanism isn't well understood even in modern Western medicine. However, a leading theory is that it acts on the central nervous system in the brain and affects how the brain perceives pain. It's thought that it may block the part itself or act on the center that regulates body temperature to reduce fever. So, unlike Loxonin I mentioned earlier, it doesn't suppress the inflammation itself, but rather blocks the heat and pain caused by inflammation at the central level. That's the characteristic of acetaminophen, suppressing the inflammation itself, in other words, reducing swelling. Acetaminophen has minimal effect, which is one of its characteristics. Let's discuss Loxonin and acetaminophen. Why are these prescribed so often? One of the reasons is that they're relatively inexpensive when they're prescribed at a hospital. For example, if you pay 30% of the cost, one Loxonin tablet is about 5 yen out of pocket. Even if you take 30 tablets a month, it only comes to around 150 yen. Acetaminophen has a similar out-of-pocket cost. It's about 3 yen per tablet. You take 2 tablets at a time. And even if you take it for 30 days, you can keep the monthly cost to about 180 yen, so it's quite... This medicine is considered inexpensive. However, visiting a clinic requires an additional 200 to 800 yen for the initial consultation or follow-up fee. That will be an additional cost, but because of these reasonable prices, this medicine is often prescribed. Over-the-counter Loxonin costs about 700 yen for 12 tablets, while Calonal is around 800 yen for 10 tablets. It's not the cheapest, but not prohibitively expensive either. Rather than going to the hospital, waiting in line for a consultation, and then going to the pharmacy to get your medicine, you can just buy it at a nearby drugstore, which I think is very convenient for busy people. So, since you can buy these over the counter, it's easy to just pick them up and use them to relieve pain. However, each of these medicines actually has side effects you need to be careful about. Without realizing it, you might take them and end up feeling unwell, or, like Mr. A mentioned earlier, you could even develop a stomach ulcer. Ensure you listen to the side effects and the top 5 most dangerous ways to take these medicines, which will be covered in the second period. Now, let's review the first period material. Loxonin is for inflammation. It's a fast-acting medicine that directly suppresses inflammation, and by controlling the substances that cause inflammation, it helps reduce pain and lower fever. On the other hand, acetaminophen works by suppressing the pain center in the brain and regulating body temperature, which also helps relieve pain and reduce fever. That's what I explained earlier. Now, for the second period that you've been waiting for, is it really safe? I'll introduce the top 5 side effects you don't want to miss and the most dangerous ways to take it. The top 5 side effects you don't want to miss and the most dangerous ways to take it. The first one is this: gastrointestinal disorders caused by Loxonin. If you've studied a little about this, you might already know. Actually, this Loxonin was the cause of the stomach ulcer that Mr. A mentioned earlier. In outpatient clinics, patients often develop gastrointestinal issues. Some viewers may have experienced stomach pain after taking Loxonin. While Loxonin suppresses inflammation-causing substances, it also suppresses substances that protect the stomach lining. Medicine comes with risks. Medications have both benefits and drawbacks. When you take Loxonin, the stomach lining's protection becomes weaker. The stomach's gastric acid, said to be more acidic than lemon juice, can then more easily damage the stomach itself. As this continues more and more, the stomach gets attacked, the lining gets eroded, and this can lead to a stomach ulcer. Another patient, Mr. B, who visits my clinic, also takes the medicine when in pain but believes it's better to do so on an empty stomach. He felt like it worked better that way and thought it was slower if he took it after eating, so he would take it when he was hungry. As a result, Mr. B was suddenly rushed to the hospital one day with a stomach ulcer. He finished his treatment safely and still comes to the clinic in good health, but he said he never imagined something as simple as a painkiller could cause such a big problem. The headaches were worse, so he ended up just enduring the stomach pain. He told me, "I wish I had consulted you sooner." Even if it's an over-the-counter medicine, I always try to ask about it, but I want everyone to make sure to tell your primary doctor about any medicine you're taking, not just assume it's okay not to mention it. All medicines can have side effects. Please always let your doctor know what you're taking. And as for precautions when taking Loxonin, make sure to take it after eating. If you take Loxonin before a meal, the side effects are more likely to occur. Please be careful about this. Here are the top 5 side effects and dangerous ways of taking medicine that you don't want to miss. The second one is this: kidney damage caused by Loxonin. Loxonin was mentioned twice in a row, but actually, Loxonin can put a strain not only on the stomach, but also on the kidneys. The kidneys are shaped like fava beans and are located on our back. They are organs about the size of a clenched fist, and their job is to filter the blood and remove waste through urine. They act like filters, Actually, Loxonin suppresses the substances that cause inflammation, but it also suppresses the substances that help maintain proper blood flow to the kidneys. So when you take Loxonin, blood flow to the kidneys can decrease, which may lead to reduced kidney function, and especially the effects of Loxonin on the kidneys. Be cautious of kidney damage in 3 situations. First, when dehydrated. The second is for elderly people, and the third is for those who already have kidney problems. In the summer, you might play sports outside, get injured, and take Loxonin for the pain. During dehydration, it's easy to strain your kidneys since your body is already lacking fluids. The amount of blood is reduced and the blood flow to your kidneys is less than usual. If you take Loxonin on top of that, the blood flow to your kidneys can get even worse and sometimes your kidney function can suddenly deteriorate. There was a man in his 60s, Mr. C, who came to the outpatient clinic because his kidney function had worsened in a health checkup. He had never had any kidney issues before, so he asked me, "Doctor, is there something wrong with me?" As I listened to his story, it turned out he was always taking Loxonin, and it was summertime when this happened. The over-the-counter medicine called Loxonin. I told him that the medicine might be the cause, so let's stop taking it for now and see how things go, then do another test after a while. As a result, Mr. C's kidney function improved safely. He likely injured himself golfing in the summer and frequently took Loxonin, which probably caused his kidney function to decline. In the summer, dehydration and medication can have more potent effects and side effects on the kidneys, especially in the elderly. That can happen, and for people whose kidneys are already in bad condition, Loxonin can make things even worse. Since it suppresses blood flow to the kidneys, there's a risk that kidney function can suddenly get much worse. So if you're worried, please visit a hospital and consult with a doctor before considering taking painkillers. Here are the top 5 side effects and dangerous ways of taking medicine that you don't want to miss. Here's the third one. Asthma attacks caused by Loxonin. Some people may not have heard that taking Loxonin can trigger asthma. Actually, there's a term called aspirin-induced asthma. When you take medicines like Loxonin, which belong to the group called NSAIDs, an allergic reaction can occur in your body, causing symptoms like wheezing and difficulty breathing, similar to asthma that just won't stop. It doesn't happen to all patients, but actually about 10% of patients who are diagnosed with asthma. Some people are suspected to have aspirin-induced asthma, where taking painkillers triggers a persistent cough. They start wheezing and having trouble breathing. That could actually be an allergic reaction. For example, I had a patient who caught a cold and took some over-the-counter cold medicine, and after that, they started having trouble breathing. There was even a patient who came to the emergency room. When I listened to their story in detail, they told me they had been diagnosed with asthma as a child, but it had gotten better as they grew up. However, this time, after taking the medicine, their asthma symptoms came back. After running various tests, we found out that this person had aspirin-induced asthma. So from now on, they need to avoid NSAIDs, including Loxonin. By stopping the painkillers, the asthma attacks never happened again. I never thought just taking cold medicine would make me feel that bad. I was really scared, thinking I might not be able to breathe. From now on, I'll make sure to go to the hospital when I need to take medicine. They said that, I'm not saying never take over-the-counter medicine, but without the right knowledge, you might keep taking a medicine without realizing the issue. So if you ever feel something is off, if you feel uneasy, I think it's a good idea to visit a doctor and consult with them. If any of you have ever used painkillers before, inform your doctor if you've had any side effects, problems, or medical advice related to the medication. Please share your experiences in the comments, as they may help other viewers. Even a brief note about learning something new, like the potential side effects of gastrointestinal or kidney disorders, would be appreciated. Even a brief comment would be appreciated. I think it will help you remember it better, so I'm eager for your feedback. Important side effects and risky ways to take it. The worst 5, here's the 4th one, caused by acetaminophen. It's liver damage. Acetaminophen is relatively mild and has few side effects, but when it comes to precautions with acetaminophen or Calonal, it's definitely liver damage. Acetaminophen is metabolized in the liver, so if you take too much, it can put a strain on your liver. When it comes to liver damage caused by acetaminophen, there are 2 main types. The first is toxic liver damage that occurs when you take too much acetaminophen. The second is having an allergy to acetaminophen or Calonal in the first place. There is liver damage that occurs, known as allergic liver damage. People who have an allergy will develop liver damage regardless of how much they take, while those who don't have the allergy will only develop liver damage if they take too much. But in reality, people who are actually allergic to acetaminophen are quite rare, even in outpatient clinics. On the other hand, people whose liver is burdened by acetaminophen are, as I mentioned earlier, most people experience the first type of toxic liver damage. This happens when you take a large amount of acetaminophen at once, or when you take a relatively high dose continuously over a long period of time. Acetaminophen is effective at relieving pain and reducing fever, but during that time, your liver is working hard to metabolize the medication. If more acetaminophen is sent to the liver than it can handle, the factory that is your liver gets overloaded, harmful substances are produced, and your body starts to take damage. That's the image you should have. So, what kind of symptoms actually appear when the liver is damaged? You might feel nauseous, experience general fatigue, notice the whites of your eyes turning yellow, or see your urine becoming darker and more orange than usual. These symptoms can appear, so always follow the prescribed dosage and instructions when taking medication, especially if you drink alcohol. Combining alcohol and acetaminophen can be dangerous. Make sure to avoid drinking alcohol. The reason is that alcohol is also metabolized by the liver, and acetaminophen is processed by the liver as well. Excessive acetaminophen use can strain your liver, causing fatigue. A student who took a large dose to reduce fever before a test ended up feeling more fatigued due to the added liver strain. Please be careful with acetaminophen usage. The whites of their eyes had also turned yellow. This is called jaundice, and it means the liver is under a lot of strain. It's a warning sign. They took too much medicine to reduce their fever, not expecting to feel this ill. They said they really regret it. Acetaminophen, it's something I often prescribe in outpatient care as well. It's one of the top 5 most convenient and effective medicines. However, there are unexpected pitfalls like this, so I hope you'll be careful. So, how much of each medicine should you actually take? I explain that question in detail in the Q&A section of the 4th period, so please check it out if you're interested. The top 5 worst side effects and dangerous ways to take medicine that you don't want to miss. Number 5 is this: painkillers for children and pregnant women. This isn't about side effects, but please be extremely careful when choosing painkillers for children and pregnant women. First, for children, when they have a fever, the medicine to take is not Loxonin. Acetaminophen can be used relatively safely. Many over-the-counter fever and pain relievers for children contain this acetaminophen. As a rule, Loxonin is rarely prescribed for children. In the case of children, side effects are more likely to occur. If you take Loxonin or other NSAIDs, which are a group of drugs, during influenza, you may develop very serious complications such as Ray's syndrome or influenza encephalopathy. Next, let's talk about pregnant women. For pain or fever during pregnancy, acetaminophen is preferred over Loxonin. Acetaminophen is used. Avoid Loxonin after the 28th week. It is contraindicated after that. In other words, you absolutely must not use it. The reason is that if a pregnant woman takes Loxonin, it can constrict the blood vessels of the baby in the womb, which can have serious effects on the baby. Also, for women who have given birth and are breastfeeding, caution is needed with Loxonin as well. You must always consult with your doctor before choosing a painkiller. Some people may not even realize they are pregnant, so if you are pregnant, or if there is a possibility that you are pregnant, be sure to consult with your doctor or a pharmacist at the drugstore. I suggest that children and pregnant women should not self-medicate, but instead consult a doctor at a hospital to prescribe appropriate medication. I think that's the best approach. Now here are the key points for the 2nd period. As for Loxonin, I mentioned that it can cause gastrointestinal problems and kidney disorders. Aspirin-induced asthma is an allergic reaction. Suddenly you may have trouble breathing like with asthma and start wheezing and making whistling sounds. I also mentioned that such allergies exist, and I explained that acetaminophen generally has fewer side effects, but it can cause liver problems due to allergies, or if you take too much, it can lead to toxic liver damage and put too much strain on your liver. I also mentioned that Loxonin is basically not used for children or pregnant women, so I hope you'll keep these points in mind as well. So, with all that said, I've discussed the risky side effects, but you likely want to know what to do and which to choose. That's probably your main concern. In the 3rd part, I'll explain how to wisely select between Loxonin and Kalonal for your specific symptom and situation. I'll provide detailed answers to guide your decision. I'll share appropriate usage methods based on your symptoms and circumstances. The key to using them based on symptoms is this. How about choosing depending on whether there is inflammation and how severe it is? For example, if you have a throbbing, intense pain, or the painful area is swollen or feels hot, These types of pain are caused by strong inflammation, so Loxonin tends to be more effective. For example, joint pain from rheumatoid arthritis, gout attacks, which are common in men, pain in the toes, pain from injuries like bruises or sprains, and sharp pain in the gums. In these cases, it's important to use something that directly suppresses the inflammation itself. Loxonin tends to be more effective. Generally, if you only take it temporarily for injuries like that, you don't need to be overly cautious with Loxonin. I don't think it's really necessary. On the other hand, for pain that doesn't involve much inflammation, it's not that severe, just a little painful. There can be side effects. I recommend Acetaminophen, which has fewer side effects. For example, tension-type headaches that come from muscle tension, they're not extremely painful. Or menstrual pain that causes discomfort or mild pain. Or when you catch a cold and have a fever. In these cases, Acetaminophen is prescribed. This is common. However, menstrual pain is usually caused by inflammation, so Loxonin tends to be more effective. Taking Loxonin for severe menstrual pain is a reasonable choice, but be cautious if taking it every time. It's better to see a gynecologist to check for uterine or ovarian abnormalities. If you have dysmenorrhea, low-dose birth control pills might be a better option. Consulting about these things is important. Many people suffer from migraines, and both Acetaminophen and Loxonin are sometimes used for migraine pain. For less severe pain, it's best to start with Acetaminophen. If that's ineffective, you can try using Loxonin. What's important when taking painkillers for migraines is to take the medicine as soon as you feel a headache coming on. So even when you go out, make sure to carry painkillers with you. Remember, it's not just about what you take, but also when you take it. Also, if your migraine doesn't respond well to Loxonin and you end up taking more and more of it, it can lead to problems with your kidneys or digestive system, as I mentioned earlier. In such cases, please visit a hospital and don't just rely on over-the-counter. Consider using specialized migraine medications. Keep in mind my previous videos about migraines linked in the description. The key points in choosing which medicine to use are incomplete in this text snippet. I've just talked about inflammation, but another thing to remember is to choose your medicine based on your body's condition. This is also a review of the second lesson. But do you remember the important side effects of Loxonin? For people with weak stomachs or those who already have gastritis, Loxonin can be difficult to use. Also, if you've been told that your kidney function is already reduced, you need to be careful with Loxonin. Also, if you have an allergy called aspirin-induced asthma, or if you are a child, pregnant, or might become pregnant, Acetaminophen is safer to use than Loxonin. Another important thing to watch out for is drug interactions. If you are taking blood thinners, there are people who take them, but if you use Loxonin together with these, it can enhance the effect, or Loxonin can. When stomach problems occur, because the blood is thinner, blood can keep leaking out and it becomes difficult to stop the bleeding. That kind of thing can also happen. So, if you are taking blood thinning medication, you need to be especially careful, so please make sure to consult your doctor. Now, here are the key points for the third period. If the inflammation is severe, there is significant swelling, or the pain is very strong, Loxonin is often chosen for such pain. For milder pain, pain not caused by inflammation, or when you have a fever, Acetaminophen or Calonal is often used. Also, depending on your physical condition and the medications you are currently taking, whether you should use Acetaminophen or Loxonin. As mentioned earlier, inform your doctor of any stomach or kidney issues, as the choice may vary. And also, if you have any liver problems, please take these factors into consideration when choosing. If you have any questions, feel free to leave a comment in the comment section. If you leave a comment, I will reply to you as much as I can within a general scope, so please feel free to reach out. Now in the fourth period, I will answer some of the questions that patients often ask me during outpatient visits at the hospital using a Q&A format from a doctor's perspective. Is there any difference between medications prescribed at the hospital and over-the-counter drugs? Is it okay to take both? If I have to take them for a long time, which one is better? These are questions I get asked a lot, so I'll answer them one by one. So the first question is, what's the difference between over-the-counter drugs and prescription medications? To give you the conclusion first, the ingredients are mostly the same. The Tylenol you can buy at the drugstore and the Acetaminophen prescribed at the hospital are almost the same in terms of ingredients. Over-the-counter drugs may contain different substances and stabilizers, resulting in minor differences. However, the active ingredients are the same, but the amount in each tablet is Be cautious about dosage differences between over-the-counter and prescription drugs. Acetaminophen tablets can contain 200 mg or 500 mg per pill, over double the difference. Always check the package insert and avoid mistakes like taking 2 pills without verifying the dosage. Please make sure to consult with your pharmacist. Now the second question, Loxonin and acetaminophen. To answer your question directly, yes, there are situations where they can be used together. If the pain is very severe, sometimes both are used alternately, or you might be instructed to take acetaminophen first, and if that doesn't work, then take Loxonin. However, this doesn't mean that anyone can just use them together. Acetaminophen and Loxonin dosages are determined based on the individual's specific situation. It should not be decided independently. We make individual decisions about whether to use them together, so please be careful about that. Some over-the-counter medicines contain both acetaminophen and Loxonin, so when using such medicines, if you take them without knowing and then take additional Loxonin, you might end up taking too much Loxonin, so please make sure to check the ingredient list on the back. Here's the third question. Even after taking the medicine, my pain doesn't go away at all. Is it okay to increase the amount of medicine I take? I get asked this a lot. I completely understand how you feel, but it's not okay to increase the dosage on your own. However, this kind of thing happens quite often. When using acetaminophen for pain, actually, for someone who weighs 60 kilograms, you might use 600 milligrams or even up to 900 milligrams at a time. If you're only taking 200 milligrams at a time because you're afraid of side effects, that amount might be too low and may not be effective, so sometimes the dosage is increased. As a general acetaminophen guideline, a 40 kilos person should take 400 mg at a time, while a 60 kilos person should take 600 mg. If it still doesn't work, sometimes a higher dose will be prescribed. And if the pain is the reason, you can actually increase the dose up to 4000 milligrams per day. So if you feel like acetaminophen isn't working at all, it might actually be because the dosage isn't enough. I recommend visiting a hospital and consulting to see if you're taking the appropriate dosage. As for Loxonin, most people take the proper amount per dose. So if it doesn't work, you basically shouldn't take extra doses. Just like Mr. A mentioned earlier, the more you increase the dosage of Loxonin, the risk of side effects will increase, so I hope you'll be careful about that. Fourth question, is it okay to keep taking painkillers for a long time? I've heard they become less effective over time. Is that true? This really depends on the case, but basically it's not a good idea to keep taking them long term. Painkillers are meant to help you get through temporary pain, and while there are some illnesses where you might need to take them continuously, ideally, you want to eventually stop using painkillers. Even acetaminophen, which is considered very safe, can put a strain on your liver if you take high doses for a long period. Also, if you end up drinking too much alcohol while taking acetaminophen, it can put even more stress on your liver. Depending on how you combine medications, it can put even more strain on your liver. Things like this can happen, and there was something else like this too. This was someone who suffered from migraines. The pain from the migraines was so bad that he was taking a medication called Loxonin, but because he was afraid the migraines would come back, he ended up taking more and more Loxonin just to feel reassured. Even though he was taking Loxonin, his headaches kept getting worse and worse. Well, he came in for a consultation in this condition, but what was actually happening was something called medication overuse headache. In other words, if you take too much medicine just for peace of mind, it can actually cause more headaches. For this patient, we introduced preventive medication for headaches and had him work on improving his lifestyle habits, and we also planned to gradually reduce the painkillers. By having him record the timing of when he took his medication in a notebook, in the end, his headaches disappeared as if they had never existed, even without taking painkillers. He was surprised, saying it felt unbelievable that he used to take so many painkillers every day, but in reality, taking painkillers was actually causing the pain. So it's important not to take painkillers habitually when you're not actually in pain. Now, to answer the second part of your question, do painkillers gradually become less effective? The answer is no, that's not the case. While some types of painkillers or certain sleeping pills can become less effective if you keep using them, that's not true for acetaminophen or Loxonin. They don't gradually lose their effectiveness. This effect has not been observed. However, on the contrary, there is something called psychological dependence, where you start to feel anxious if you don't have the medication. This kind of psychological dependence can actually increase over time. For example, you might end up taking 2 doses at once because 1 dose doesn't relieve your anxiety. That's why it's important to use painkillers correctly. Now, for the last question, are there any combinations or things you should be careful about with food or drinks when taking painkillers? Be cautious when taking these medications. Take them after meals, not before, to avoid excessive potency and gastrointestinal issues, especially with Loxonin. As a rule, take them with about 200 cc of water or lukewarm water. Avoid taking them with juice, particularly grapefruit juice. If you take them with something like grapefruit juice, it can affect the way the medication is metabolized, so please remember to always take them with water. If you absolutely have to take painkillers, if you need to take Loxonin long term, sometimes a stomach medicine may be prescribed together with other medications, depending on how they interact. If you have an underlying condition or regularly visit the hospital for another illness, it's safer to get painkillers from your doctor in those situations. Please keep that in mind. Key points for the fourth period: Loxonin and Acetaminophen. The active ingredients in over-the-counter and hospital-prescribed medications are identical, but the amount differs. Using both medications together should only be done under a doctor's guidance. It's quite common for both to be used together, so if your pain isn't relieved, please consult with your doctor. And if the medication doesn't work, please do not increase the dosage on your own. Especially with acetaminophen, it is often prescribed in smaller amounts per dose, so sometimes increasing the amount per dose as needed can sufficiently relieve pain or reduce fever. Please remember this. Also, I want you to avoid taking painkillers for a long period just for peace of mind. Taking this medicine for reassurance or to ease anxiety can lead to psychological dependence. So, please make sure to follow the prescribed dosage and remember not to take the medicine when you are not in pain. Also, I would appreciate it if you remember the basic rule of taking your medicine after meals with water. How was that? Loxonin and acetaminophen are excellent medicines that I prescribe very frequently, almost daily. These medicines are frequently prescribed, so there are things to be cautious about. I put a lot of effort into this lengthy video. If you watch it, take notes and listen multiple times, you'll be able to use painkillers safely. Write what you learned in the comments as your notebook for easier review. If you found the video helpful, please hit the like button. If not, disliking is okay too, so please provide feedback. I would really appreciate it. At YouTube Medical University, I will keep sharing accurate information responsibly from a doctor's viewpoint. To not miss new videos, please subscribe. It's really encouraging. See you in the next video. As a general practitioner, I've learned from my patients how to live without aging, even in your 70s and beyond. I want to live this way too. These stories contain lessons I've received from many of my patients. Chatting with friends is more important than exercise. When it comes to medication, less is often better than more. These are some of the lessons I've learned from my seniors in life. The video shares wisdom on living healthily and happily at any age. Check out the description for more details.